93 million people in this country who are eligible for vaccination who are not yet vaccinated, they give the virus a lot of leeway to circulate and ultimately perhaps be an even more difficult variant. When you give them free rein to be circulating in the community, you give them ample opportunity to mutate even more.
Dr. Fauci on the surging Delta variant as the U.S. reported over 140,000 new COVID cases on Friday. That's the highest single-day total since January, and hospitalizations are also on the rise in 42 states. What does it all mean as students at all levels start to go back to school? Joining us now to help make sense of it all is Dr. Richard Besser, the president and CEO of the Robert Wood Johnson Foundation and a former acting director at the CDC. Dr. Besser, before we get to COVID, I want to ask you about the breaking news out of Haiti, another devastating earthquake. You were there in 2010 as Haiti suffered one of the deadliest earthquakes in history. What is your sense on the challenge Haitians are facing on the ground right now in this relief effort?
Yeah, you know, John, that was some of the first reporting I did for ABC News. But when you see a tragedy, a natural disaster of this extent in a country that already has challenges to begin with, both political and economic, and in terms of infrastructure, this is going to be absolutely devastating. We've not yet been able to see the full extent of this, the toll in terms of lives lost, and the challenges they're going to face in terms of providing the basics of food, water, and shelter.
It's just horrifying. Let me ask you about, and of course they have a major COVID problem in Haiti and virtually no vaccinations. In terms of the COVID challenge we're seeing now with hospitalizations up, infections up, how bad do you believe this is going to get? Is it going to get to the level where we're going to have to see once again shutdowns, restaurants closing, the economy essentially grinding to a halt? Is it going to get to that level again?
I don't think so, John. I think what we're going to see is schools closing when cases spread through schools. We're going to see more recommendations for use of masks. The reason it's not going to be the same as it was early in the pandemic is that there is a vaccine, and we've done a very good job at vaccinating people who are at the greatest risk. So elderly people, people with underlying medical conditions, frontline healthcare workers. So there has to be a full-on press to get people vaccinated who aren't vaccinated. That's what's going to do the most. But it's not going to be the same kind of situation that we saw a year ago.
For much of this pandemic, we've seen it hit especially hard among older people. But now we're seeing an alarming number of infections and even hospitalizations with children. What has happened? Is this the changing variant, or what is going on?
Yeah, I'm a general pediatrician, and it gives me great concern. Not that it's getting more severe for children. I don't think the evidence for that is very strong. But the fact that so many more children are getting infected, the fact that there are that many cases, that this variant spreads so easily, means that there will be thousands of more children who are hospitalized, and unfortunately, there will be more children who die. What we can do to try and make that not a foregone conclusion is to take all of the steps to protect kids. And the biggest one is to get vaccines to people who aren't yet vaccinated, get people to have their questions addressed by trusted healthcare providers and make decisions around vaccination, and not allow people who aren't vaccinated to be in situations where they're potentially exposing those who are unvaccinated, including children.
Can you clear up something for me? I've seen conflicting reporting on the question of those who have already had COVID. Is there a need to get vaccinated if you have already been infected?
Yeah, there's more and more data coming in on that you will get longer lasting, higher levels of protection if you also get vaccinated. And, it's not true for every infection. There are many infections where getting a natural infection provides you with lifelong protection. But here, what they're seeing is that people who are vaccinated have a higher level, stronger level of protection. So even if you've had COVID infection, you should get the vaccine.
All right, Dr. Richard Besser, thank you very much for joining us this morning.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.